Imagine for a moment that your breath is more than just air moving in and out of your lungs, that each inhale is an opportunity to reset your body, and each exhale a chance to release not just tension, but stress that silently pushes your blood sugar higher. Our breath is both intimate and universal, a bridge between the conscious and the unconscious, connecting mind, body, and physiology in ways science is only beginning to fully understand. Studies reveal that controlled breathing can influence the autonomic nervous system, reducing cortisol levels, calming the heart, and even improving insulin sensitivity. In essence, the rhythm of your breath is a subtle but powerful lever over your internal chemistry. Doctors now observe that many patients with prediabetes or chronic stress can benefit from simple, deliberate breathing patterns. One technique, the 4-7-8 breath, encourages slow inhalation, gentle retention, and measured exhalation. Clinically, this reduces sympathetic nervous system activity, the fight-or-flight response, which is directly linked to elevated glucose levels. Another method, diaphragmatic breathing, engages the lower lungs and stimulates the vagus nerve, enhancing parasympathetic tone and fostering a state of restorative calm. These are not just exercises for the lungs but interventions for the entire metabolic system, gently nudging the body toward balance. What fascinates me is the dialogue between science and philosophy in this practice. When we breathe with intention, we aren't just manipulating oxygen, we are consciously communicating with our physiology, reminding the body that it is safe to rest, to repair, to regulate. The body responds to trust and calm with measurable improvements: a lower cortisol, steadier heart rate, and better glucose control. Even brief sessions practiced consistently can influence post-meal blood sugar spikes, highlighting the intimate connection between mental state and metabolic health. As we explore these techniques, it becomes clear that breathing is a form of medicine we always carry with us. By observing your breath, slowing it, and aligning it with mindful awareness, you transform a mundane daily act into a practice of profound physiological and psychological significance. Your lungs, your heart, and your pancreas all respond. It's a gentle, immediate, and scientifically supported intervention that anyone can access. Doctors emphasize that this is not a replacement for medical treatment, but a complementary strategy. They encourage patients to integrate mindful breathing into daily routines, particularly during periods of stress, before meals, or after physical activity. The practice is simple, requiring no equipment, yet it reaches into the deepest layers of human biology, connecting thought, emotion, and metabolic function in a single, elegant gesture: conscious breath. Imagine sitting quietly, feeling the rise and fall of your chest, and realizing that this simple, continuous act of breathing holds profound influence over your entire physiology. Breath is often overlooked in modern life, something we take for granted, yet it serves as the most intimate connection between our conscious mind and the unconscious workings of the body. Each inhale brings oxygen that fuels cellular energy, and each exhale removes carbon dioxide. But beyond these chemical exchanges, breathing acts as a subtle regulator of our nervous system, our hormonal balance, and ultimately our metabolism. When stress creeps into daily life, when deadlines press, relationships demand, or uncertainty looms, our bodies respond automatically, often without our awareness, releasing cortisol and other stress hormones that shift the body into a state of vigilance. These stress responses, while useful in acute situations, can over time raise blood sugar levels, make insulin less effective, and create a cycle where the mind and body feel increasingly disconnected. The rhythm of breath provides a bridge over this disconnection. It is a tool that is simultaneously physical, emotional, and chemical, linking mental focus with metabolic regulation in ways both subtle and profound. Research in physiology and endocrinology has demonstrated that controlled breathing can influence the autonomic nervous system, the network that governs involuntary bodily functions. Within this system, the sympathetic branch drives the fight or flight response, accelerating heart rate, raising blood pressure, and releasing glucose into the bloodstream for immediate energy. The parasympathetic branch, in contrast, promotes rest, digestion, and repair, slowing the heart, lowering stress hormone levels, and stabilizing blood sugar. By modulating our breathing, we can intentionally activate the parasympathetic system. Techniques such as slow, deep inhalations and extended exhalations send signals to the vagus nerve, a critical conduit between the brain and many organs, that the body is safe and can relax. As parasympathetic activity rises, cortisol and adrenaline diminish, heart rate variability improves, and insulin sensitivity can stabilize, illustrating that our breath is more than a respiratory function. It is a metabolic regulator in real time. Doctors and clinicians observing patients with prediabetes or chronic stress have noted remarkable changes when simple breathing exercises are incorporated into daily routines. A patient who begins a daily practice of mindful breathing often reports a sense of calm within minutes. Yet physiological monitoring shows more than subjective benefit. Blood sugar measurements taken after meals can display lower peaks, stress hormone levels can decrease, and the heart can maintain a steadier rhythm, suggesting a measurable link between mental calmness and metabolic balance. This interplay between mind and body highlights a principle that is both philosophical and scientific. We are not passive recipients of physiological processes, but active participants who can influence internal chemistry through awareness and intention. The act of inhaling deeply, holding for a moment, and exhaling fully is in itself a statement to the body that it is safe to restore equilibrium. The bridge between breath and metabolism also emphasizes the importance of timing and focus. When we breathe rapidly in response to anxiety, our sympathetic nervous system becomes dominant, the body floods with glucose, and energy is mobilized but not always used, which can strain the pancreas and worsen insulin resistance over time. By contrast, deliberate breathing creates a rhythm that the body recognizes as calm and safe, allowing glucose to be processed efficiently rather than accumulating unnecessarily in the bloodstream. This insight is particularly important in the context of post-meal routines where stress and digestion intersect. Taking a few moments to engage in slow, mindful breathing after eating can signal the body to optimize insulin response, improve nutrient absorption, and reduce the likelihood of sharp blood sugar spikes. Philosophically, breath serves as a reminder that we are not separate from our physiology, but intimately entangled with it. Each conscious inhale reconnects the mind to the body, aligning emotional state with biological processes. Scientific inquiry is now validating what contemplative practices have long suggested: intentional breath affects heart rate, hormonal secretion, immune function, and metabolic regulation simultaneously. This convergence of science and lived experience offers hope, particularly in an era where stress and metabolic disorders are increasingly prevalent. It invites us to consider that simple interventions, accessible to anyone at any time, can produce profound benefits without the need for expensive equipment or complex routines. It is also noteworthy that breathing exercises are inherently adaptable. They can be practiced lying down, sitting, or even walking slowly, making them accessible regardless of mobility or lifestyle. Short sessions, even 5 to 10 minutes a day, can accumulate into meaningful changes over weeks and months. This accessibility underscores the principle that the bridge between mind, body, and metabolism is not confined to specialized settings or elite practitioners, but is available to every individual willing to pay attention to their breath. Doctors often recommend integrating breath awareness into daily life as a complementary approach to managing blood sugar, emphasizing that while it does not replace medical treatment, it can enhance overall metabolic control, reduce stress-related complications, and foster a sense of agency over one's health. The scientific curiosity surrounding breath is expanding rapidly, revealing mechanisms through which oxygenation, carbon dioxide retention, and autonomic modulation influence metabolic pathways. Researchers are exploring how rhythmic breathing affects the hypothalamic, pituitary adrenal axis, the central stress response system, and how these effects cascade down to impact glucose regulation. This growing body of evidence aligns beautifully with the experiential wisdom of those who have long recognized that mindful breathing can center the mind, calm the body, and support holistic wellness. Understanding this connection encourages reflection. Every breath is an opportunity to participate in the dialogue between consciousness and physiology, a practice that merges science, philosophy, and human compassion. In practicing deliberate breathing, we not only manage stress and support blood sugar regulation, but we cultivate an awareness of our intrinsic capacity for self-regulation. The bridge between mind, body, and metabolism becomes tangible, experienced in the rise and fall of the chest, in the gentle slowing of the heartbeat, in the subtle sense of calm that accompanies focused attention. Each breath reinforces the understanding that health is not only about the nutrients we consume or the medications we take, but about our daily choices in how we engage with our own physiology, how we honor the signals of stress, and how we allow the body to respond with balance and efficiency. Consider the simple act of breathing in a deliberate, measured way and how it can quietly transform the internal environment of the body. The 4-7-8 breathing technique, for instance, is not just a mindful exercise but a physiological intervention. It begins with inhaling gently for 4 seconds, allowing air to fill the lower lungs, expanding the diaphragm fully. This conscious engagement of the diaphragm signals to the body that energy is being delivered efficiently, stimulating a cascade of responses in the nervous system. Holding the breath for 7 seconds allows oxygen to circulate and carbon dioxide levels to balance, creating a moment of pause where the body registers a sense of stability. The exhale lasting 8 seconds becomes a release, not just of air but of tension, stress hormones, and sympathetic nervous system dominance. In this extended exhalation, the parasympathetic system is activated, calming heart rate, lowering blood pressure, and facilitating metabolic processes, including the regulation of glucose. This method may seem simple, yet its effects are rooted in complex interactions between the lungs, the vagus nerve, and the endocrine system, illustrating how precise timing and awareness can influence internal chemistry. Diaphragmatic breathing, another cornerstone of stress reduction and metabolic regulation, emphasizes full engagement of the diaphragm rather than shallow chest breathing. When the diaphragm moves efficiently, it massages the internal organs, stimulates the vagus nerve, and enhances circulation in the abdominal cavity. This deep, rhythmic motion encourages the body to shift from a state of alertness to one of rest and restoration. Scientists observe that this type of breathing reduces sympathetic nervous system activity while enhancing parasympathetic tone, which directly impacts cortisol levels and insulin sensitivity. The pancreas, liver, and other metabolic organs respond favorably to this reduction in stress signals, improving glucose uptake and helping the body maintain steady blood sugar levels even under conditions that would normally provoke spikes. For patients struggling with stress-induced hypoglycemia, incorporating diaphragmatic breathing into daily routines can be transformative, offering a practical, accessible tool for metabolic control. What is remarkable about these techniques is their immediacy. Unlike medications that take hours or days to reach full effect, controlled breathing can induce measurable physiological changes within minutes. Heart rate variability, a marker of autonomic nervous system balance, improves during a session of 4-7-8 or diaphragmatic breathing. Blood pressure can dip slightly but meaningfully, and the subjective experience of calm becomes tangible. Clinicians note that patients often describe a sense of grounding, an increased clarity of thought, and even a diminished perception of hunger or cravings. From a scientific perspective, these observations are supported by data showing that controlled breathing reduces stress hormone secretion and stabilizes glucose levels. The mind and body are no longer operating in a reactive loop dominated by stress, but are engaged in a conscious, modifiable dialogue. The philosophical significance of these breathing techniques lies in the deliberate allocation of attention. When a person focuses on the rhythm of inhalation, retention, and exhalation, they are training the nervous system to recognize safety and stability. Each session becomes an exercise in biofeedback, where the mind's awareness translates into tangible shifts in physiology. It demonstrates a profound truth: the nervous system, metabolism, and emotional state are not isolated systems but interconnected networks. By mastering the rhythm of the breath, an individual can influence multiple pathways simultaneously, achieving stress reduction, enhanced metabolic function, and improved overall well-being in a unified practice. This convergence of mind and body underlines why doctors increasingly recommend these techniques as complementary approaches in managing both stress and blood sugar. Another important aspect is the adaptability of these methods. The 4-7-8 technique can be practiced almost anywhere, whether sitting at a desk, lying in bed, or even standing in line, allowing individuals to harness the calming effects in moments of acute stress. Diaphragmatic breathing can be incorporated into movement routines, post-meal relaxation, or meditation, reinforcing metabolic stability throughout the day. Consistency amplifies the benefits. Short, daily sessions create a cumulative effect on the autonomic nervous system and glucose regulation. The evidence suggests that even 5 to 10 minutes of focused practice can improve heart rate variability, decrease cortisol, and blunt postprandial blood sugar spikes. These benefits illustrate that small intentional actions, repeated consistently, can yield profound changes in both mental and physical health. Medical professionals emphasize that these breathing exercises are supportive tools, not replacements for prescribed treatments. For individuals with diabetes or metabolic syndrome, combining mindful breathing with nutrition, physical activity, and medication, as appropriate, can produce synergistic benefits. By calming the sympathetic nervous system, these techniques reduce the harmful effects of chronic stress on glucose metabolism. They provide a form of self-regulation that empowers patients to participate actively in their health, reinforcing the principle that our bodies are dynamic systems responsive to both internal and external cues. The science behind these techniques continues to unfold, with research exploring the mechanisms linking controlled breathing, the autonomic nervous system, and metabolic function. Studies are examining how precise breath patterns influence vagal tone, modulate the hypothalamic pituitary adrenal axis, and improve insulin sensitivity. Early findings support what clinicians and practitioners have observed for years. Breath is a tool that can reach deep into the body's regulatory systems, influencing everything from heart rate to glucose metabolism, demonstrating the power of intentional, rhythmic breathing as a bridge between conscious practice and physiological health. As one engages in these techniques, the connection between mind, body, and metabolism becomes more tangible. The act of inhaling, holding, and exhaling is no longer mechanical but transformative. Each session reinforces the body's capacity for balance, resilience, and efficient metabolic function. The 4-7-8 technique and diaphragmatic breathing exemplify the principle that conscious awareness can directly influence health, and that something as fundamental as breath, practiced intentionally, can become a powerful intervention for stress reduction and blood sugar regulation. When we pause to notice the breath, we are engaging in more than a simple mechanical act. We are entering into a dialogue with our physiology, a subtle conversation that influences every system in the body. Most of the time, breathing happens automatically, guided by reflexes, responding to oxygen demand, carbon dioxide levels, and involuntary nervous system signals. Yet when we breathe consciously, with attention and intention, we are choosing to participate actively in this process, shaping our body's responses and gently nudging the internal environment toward equilibrium. This conscious engagement signals to the brain and the autonomic nervous system that it is safe to relax, that the body can transition from a state of vigilance to one of restoration, and that the chemistry of stress, including cortisol and glucose release, can be modulated. The act of observing the breath is both simple and profound, an accessible gateway to influencing physiological processes that are otherwise automatic. Physicians and researchers increasingly recognize that conscious breathing has measurable benefits for metabolic health. When the breath is slowed and deepened, particularly using techniques that emphasize full diaphragmatic engagement, parasympathetic activation increases. The vagus nerve, which runs from the brainstem through the chest and abdomen, responds to this stimulation by reducing heart rate, lowering blood pressure, and signaling organs involved in digestion and metabolism to operate in a more balanced and restorative manner. One of the most significant impacts of this shift is on glucose regulation. Stress triggers the release of glucose into the bloodstream as part of the body's fight or flight preparation, a response that can be beneficial in the short term but harmful if prolonged. By consciously regulating the breath, individuals can interrupt this cascade, reducing excessive glucose release and improving insulin sensitivity, demonstrating that the mind, through awareness, can influence metabolic function. The dialogue between breath and body extends beyond mere physiology. It touches upon emotional and cognitive domains. When an individual focuses on the rhythm of inhalation and exhalation, attention shifts away from anxious thoughts or ruminations, creating a mental space that fosters calm and clarity. This shift is not merely psychological, but also biochemical. Lowered stress perception correlates with reduced cortisol levels, and as cortisol decreases, the body experiences less glucose dysregulation. Doctors note that patients who incorporate conscious breathing into their daily routines often report a sense of groundedness, improved mood, and diminished cravings or emotional triggers for overeating. The physiological benefits are thus mirrored by improvements in mental and emotional states, highlighting the inseparable nature of mind and body in health management. The practice of conscious breathing also illustrates the principle that self-regulation is attainable and measurable. Simple interventions, such as taking a few minutes to breathe deeply, observing each inhale and exhale, or counting breaths with focused attention, produce quantifiable effects on heart rate variability, blood pressure, and blood glucose. These are not abstract or subtle changes but measurable shifts that underscore the body's responsiveness to conscious engagement. The implications are significant. Even brief periods of focused breathing, practiced consistently, can support post-meal blood sugar stabilization, reduce the physiological impact of daily stressors, and promote overall metabolic balance. This makes conscious breathing a uniquely accessible, cost-free, and powerful tool that individuals can use independently, regardless of age, fitness level, or medical condition. Philosophically, conscious breathing invites reflection on the relationship between awareness and health. It demonstrates that the body is not a passive entity, but a responsive system capable of adjusting its chemistry, autonomic function, and hormonal balance in response to attention and intention. This awareness fosters trust in the body's inherent capacity to restore balance, promoting a sense of agency in managing stress and metabolic health. It is a reminder that our internal state is not dictated solely by external circumstances, but can be influenced through mindful, intentional practice. The breath becomes a medium for cultivating harmony between thought, emotion, and physiology, transforming a simple daily act into a form of personal medicine. Clinicians emphasize that conscious breathing complements other health strategies, rather than replacing them. For individuals managing blood sugar, integrating mindful breathwork alongside proper nutrition, physical activity, and medication as appropriate can enhance outcomes. The effects are synergistic. By reducing sympathetic activation and promoting parasympathetic tone, conscious breathing reduces the physiological burden of stress, improves digestion and glucose uptake, and supports cardiovascular health. The accessibility and immediacy of these practices make them particularly valuable in daily life, offering opportunities for intervention at moments of heightened stress, before or after meals, or during periods of emotional challenge. The science continues to illuminate the mechanisms through which conscious breathing affects metabolic health. Studies examining vagal tone, heart rate variability, and cortisol regulation provide insight into how this simple practice interacts with complex bodily systems. Evidence shows that intentional breath modulation can alter the hypothalamic pituitary, adrenal axis, influence glucose metabolism, and enhance insulin sensitivity, highlighting the profound physiological consequences of what may appear to be a mundane act. This understanding bridges empirical research and practical application, demonstrating that conscious breathing is not merely a wellness trend, but a scientifically grounded intervention capable of producing real, measurable benefits. Engaging in conscious breathing also cultivates awareness of subtle physiological cues. As one observes each inhalation and exhalation, sensations of tension, rapid heartbeat, or shallow chest breathing become more apparent, offering an opportunity for adjustment and correction. This mindfulness reinforces the body's capacity to self-regulate, creating a feedback loop in which attention leads to physiological adaptation, which in turn enhances awareness and intentionality. Over time, this practice strengthens resilience, allowing the body to respond more effectively to stress, improve metabolic control, and maintain homeostasis even in challenging circumstances. Through the simple, continuous act of conscious breathing, we cultivate a profound connection between mind and body. Every inhalation and exhalation becomes a moment of intervention, a chance to signal to the body that it can relax, restore, and regulate. This practice transforms everyday respiration into an intentional dialogue with physiology, one that is accessible to anyone, measurable in its effects, and deeply supportive of both mental and metabolic health. Conscious breathing demonstrates that attention and intention are powerful forces, capable of shaping internal environments, fostering trust in the body, and promoting balance across emotional, cognitive, and biochemical domains. Imagine finishing a meal and noticing the subtle tension that often follows. The way the body begins to shift into digestion, sometimes accompanied by restlessness, fatigue, or even stress that silently impacts blood sugar levels. Post-meal periods are a delicate time for the body, as glucose from food enters the bloodstream and insulin works to transport it into cells. During this window, the autonomic nervous system plays a crucial role in regulating metabolism. Stress, even mild or subconscious, can trigger the sympathetic branch, releasing cortisol and other stress hormones that raise blood sugar and impair insulin effectiveness. It is here in these ordinary moments that a short, intentional breathing session can have profound effects. By taking just 5 to 10 minutes to engage in slow, measured inhalations and exhalations, we activate the parasympathetic system, signaling to the body that it is safe to process nutrients efficiently, restore balance, and manage internal chemistry. Short, consistent sessions of conscious breathing have been shown in clinical observations and research studies to improve heart rate variability, lower cortisol, and modulate glucose metabolism. The power of these sessions lies not in their length but in their regularity and intentionality. When practiced consistently, even brief exercises accumulate benefits over days and weeks, gradually reinforcing parasympathetic dominance and reducing the body's tendency to overreact to stress. For individuals managing blood sugar, This practice can become a practical strategy to stabilize postprandial glucose spikes. The act of breathing deeply and mindfully for a few minutes is more than relaxation. It is a physiological cue that the body responds to with measurable effects, enhancing metabolic efficiency and creating a sense of calm that extends well beyond the immediate session. What is particularly fascinating is the immediacy with which the body responds. Studies on autonomic modulation indicate that heart rate, blood pressure, and even glucose handling begin to shift within minutes of focused breathing. A patient practicing diaphragmatic breathing, or the 4-7-8 technique, after a meal may feel a sense of mental calm and physiological lightness, while concurrently, cortisol levels begin to decrease and the body signals the pancreas to process glucose more effectively. These responses highlight the interconnectedness of mental state and metabolic function, demonstrating that even small, intentional interventions can have measurable health benefits. The simplicity of the practice makes it accessible to nearly everyone, yet the effects ripple through the nervous, hormonal, and metabolic systems, producing results that are both immediate and cumulative. Consistency is the key to maximizing the impact of these short sessions. By incorporating breathing exercises into a daily routine, individuals can reinforce the body's natural regulatory mechanisms. Morning and evening practices may set the tone for the day and support restorative processes at night, while post-meal sessions specifically target glucose control during periods of heightened metabolic activity. The accumulation of these micro-interventions enhances the body's ability to manage stress, maintain insulin sensitivity, and stabilize blood sugar over time. Doctors often emphasize that even when time is limited, the cumulative effect of repeated, focused breathing is far more impactful than sporadic or overly long sessions practiced infrequently. Another dimension to consider is the interplay between mental and metabolic benefits. Post-meal periods are often accompanied by distractions, screen time, or emotional stressors, which can subtly activate the sympathetic nervous system. By deliberately inserting a short breathing exercise during this time, individuals create a mindful pause that allows both the mind and body to recalibrate. Attention is drawn away from stressors and toward the physiological experience of breath and bodily sensation. This redirection of focus not only calms the nervous system, but also improves awareness of internal cues such as satiety, energy levels, and tension, fostering a deeper connection between conscious choice and metabolic response. Research on stress physiology reinforces the idea that these brief interventions are more than psychological. They produce tangible biochemical changes. Cortisol, a primary stress hormone, can rise significantly in response to acute mental or emotional stress, impairing insulin action and promoting elevated postprandial glucose. Focused breathing reduces this sympathetic activation, stimulating the parasympathetic system and encouraging a metabolic state conducive to glucose uptake and cellular energy utilization. By reducing cortisol and improving autonomic balance, the body is better able to process nutrients efficiently, avoid unnecessary spikes in blood sugar, and maintain energy homeostasis. This demonstrates that short breathing sessions, though simple in practice, operate at a complex physiological level, modulating systems that influence both immediate and long-term metabolic health. The accessibility and simplicity of these practices are part of their beauty. Unlike interventions requiring equipment, special locations, or extended periods of time, a short, focused breathing session can be performed almost anywhere. A few minutes at the dining table, in the kitchen, or sitting comfortably in a chair can be enough to engage the body's regulatory systems. This accessibility encourages adherence and transforms ordinary moments into opportunities for health intervention. By practicing consistently, individuals build a habit that becomes almost automatic, creating a structured framework for supporting stress reduction and metabolic balance without adding significant time or effort to daily life. Importantly, doctors highlight that these exercises complement broader health strategies rather than replace them. For people managing diabetes or prediabetes, integrating short, mindful breathing sessions with balanced meals, physical activity, and appropriate medications can produce synergistic benefits. The reduction in post-meal stress hormones enhances insulin sensitivity and improves overall metabolic control, demonstrating that even small, intentional practices can have meaningful impacts when combined with holistic lifestyle approaches. Over time, these sessions cultivate resilience, improve awareness of physiological responses, and reinforce the body's natural ability to maintain equilibrium. Through repeated, consistent practice, short breathing exercises cultivate both physiological stability and psychological calm. They demonstrate the body's remarkable capacity to respond to intention, illustrating that even brief moments of focus can shape internal chemistry, influence glucose metabolism, and reduce the physiological impact of stress. By integrating these practices into daily routines, individuals create a supportive environment for health, harnessing the power of the breath to influence post-meal blood sugar, autonomic balance, and overall well-being in the realm of health and medicine. There is a growing recognition that some of the most powerful interventions are also the simplest, accessible to anyone at any time. Breathing exercises exemplify this principle, functioning as complementary practices that support conventional treatments while offering profound physiological and psychological benefits. Physicians increasingly recommend these exercises not as replacements for medication, dietary management, or exercise, but as tools that enhance the body's natural regulatory systems. This approach reflects a deeper understanding of human biology. The autonomic nervous system, endocrine function, and metabolic balance are intimately intertwined, and deliberate modulation through breathing can create measurable improvements in health outcomes. What makes this remarkable is that the breath, something so intrinsic and constant, is also one of the most potent instruments we have to influence these internal systems. Doctors observing patients with diabetes, prediabetes, or stress-related metabolic challenges report that integrating breathing exercises into daily routines produces consistent benefits. Patients who adopt simple practices such as diaphragmatic breathing or structured techniques like 4-7-8 often experience not only reduced stress and anxiety, but also improvements in blood sugar regulation. The explanation lies in physiology. Conscious breathing directly stimulates the parasympathetic nervous system, slowing heart rate, lowering cortisol, and optimizing insulin sensitivity. By shifting the body away from sympathetic dominance, these exercises mitigate the effects of chronic stress that otherwise exacerbate hyperglycemia. The impact is both immediate and cumulative, allowing individuals to experience moments of calm while reinforcing long-term metabolic stability. The beauty of breathing exercises lies in their simplicity and accessibility. Unlike interventions requiring specialized equipment, extensive time commitments, or complex protocols, conscious breathing can be performed almost anywhere, sitting in a chair, lying on a bed, or even standing in a quiet corner. This accessibility ensures adherence and fosters consistency, which is crucial for measurable health benefits. Short sessions, practiced daily, create a rhythm that the body comes to recognize as a signal for restoration and balance. With repeated practice, these exercises enhance heart rate variability, improve autonomic balance, and support glucose regulation, demonstrating that small, intentional acts performed consistently can have profound effects on both mind and body. From a clinical perspective, these practices are often prescribed as part of holistic care plans. For individuals managing diabetes or metabolic syndrome, doctors may recommend brief sessions of mindful breathing following meals, during periods of stress, or at the beginning or end of the day. The goal is to harness the natural capacity of the nervous system to regulate metabolic processes, reduce stress hormone secretion, and promote cellular efficiency. In essence, breathing exercises empower patients to take an active role in their health, providing a method of self-regulation that complements medications, nutrition, and physical activity. By practicing consistently, patients cultivate resilience, enhance awareness of physiological cues, and gain a sense of agency in managing their internal environment. Scientific research increasingly supports these clinical observations. Studies have shown that conscious breathing can influence the hypothalamic pituitary adrenal axis, modulate vagal tone, and improve parasympathetic activity. These effects have downstream consequences for blood sugar management, as the reduction of cortisol and sympathetic activation allows insulin to operate more effectively. In addition, research indicates improvements in cardiovascular markers, such as blood pressure and heart rate variability, which are often compromised in individuals with chronic metabolic stress. This growing body of evidence underscores the fact that breathing exercises are not merely wellness practices, but interventions grounded in physiological mechanisms with measurable outcomes. Another compelling aspect is the intersection of mental and physical benefits. Doctors emphasize that breathing exercises address both stress and metabolic regulation simultaneously. As stress is reduced, the body no longer perceives a constant threat that demands elevated glucose, and cognitive clarity often improves, enhancing decision-making regarding nutrition, activity, and lifestyle. Patients report feeling calmer, more focused, and better able to respond to challenges without the typical physiological spikes in stress hormones that can destabilize blood sugar. This dual impact highlights the integrative power of conscious breath, bridging mind, body, and metabolism in a way that few other interventions can achieve so efficiently and accessibly. The adaptability of breathing exercises is also a key factor in their effectiveness. Techniques can be adjusted for intensity, duration, and context, making them suitable for people of all ages, mobility levels, and health conditions. Even those who are sedentary or have limitations due to joint pain or cardiovascular concerns can engage in diaphragmatic or paced breathing. Over time, the practice fosters self-awareness and attunement to the body's subtle signals, such as tension, shallow breathing, or rapid heart rate, allowing for early intervention before stress or glucose dysregulation becomes pronounced. This self-regulatory capacity reinforces the notion that health is not solely the product of external interventions, but also the result of internal, conscious engagement. Doctors often describe breathing exercises as foundational tools for wellness that augment the effectiveness of other therapies. By lowering stress hormones, improving autonomic balance, and supporting insulin sensitivity, these practices create a more favorable physiological environment for the body to respond to medication, dietary adjustments, and physical activity. The simplicity of the method encourages consistency, while the measurable benefits validate its use as a complementary approach. Patients who incorporate these exercises routinely often report a sense of empowerment, understanding that they have a tool always available, requiring no technology, cost, or special conditions to improve their health. Ultimately, the practice of conscious breathing embodies a philosophy that blends science, mindfulness, and compassion for the self. It reminds us that health is not merely a series of external actions, but a continuous conversation between the mind and body, one that can be influenced through attention, intention, and simple, deliberate acts. By engaging in regular breathing exercises, individuals create a bridge between awareness and physiology, supporting stress reduction, enhancing metabolic function, and cultivating resilience. The recommendation from doctors to integrate these exercises into daily life is not simply a suggestion for relaxation. It is a scientifically supported, profoundly accessible strategy for improving well-being, empowering individuals to participate actively in their health, and reinforcing the body's innate capacity for balance and restoration.